The reason we're here is for PANDAS and PANS Awareness Day. So PANDAS, not to be confused with the little black and white stuffed animal or furry creature that we're so familiar with, but it stands for Pediatric Autoimmune Neuropsychiatric Disorder Associated with Streptococcal Infections. And that's a big mouthful, but it's one of those conditions that is rarely understood or often misdiagnosed, but the symptoms are very familiar. People are very familiar with the obsessive compulsive disorders, the motor tics, the things such as hand washing, bedwetting that starts almost uncontrollably, anxiety, separation anxiety, sleep disturbances, etc. But before we get started, the reason, again, we are here is because we want to bring awareness to this condition that is more prevalent than most people really realize. And so we're honored to have all of you here. But today we join 28 other states who have already either issued or declared or in the process of declaring PANDAS PANS Awareness Day. So very honored to actually be one of the forefront states who is doing this. I do want to introduce Mr. Stephen Buck, who is the Deputy Commissioner here at the Oklahoma Department of Mental Health, and we're very honored that he and his group are very familiar with this condition, at least the symptoms, and he's going to present the proclamation and let you know a bit more about really what this entails. So, Steve, if you'd come forward.
Well, good morning. I am honored to be here today and absolutely appreciative of this opportunity to share a few moments with you and then to present an appreciation or the proclamation from Governor Fallin for the proclamation of today's events. I really have to tell you that when I was first extended the opportunity to come here today, Secretary Klein, our Secretary of Health and Human Services, had asked Terry White and I if we could represent him. He was unavailable today, and I had the opportunity to do so. It allowed on my schedule. The first thing I did was, okay, let's find out more about PANDAS and PANS. It was really something new to me. I come from a non-clinical background. And as I began to read about this and I began to visit with some of the clinicians who work for our agency, I developed a greater understanding of the complexity of this and the difficulty in diagnosis and the absolute challenges that PANDAS and PANS might apply to the parents and the families who are experiencing this disorder. I was able to very quickly reflect back on the fact that one of my children has a very complex disease that looks somewhat comparable to this. In fact, early in her prognosis, this was one of the issues that was considered for her condition. And I began to realize how complex and how frustrating this must be. As families walk through this level of diagnosis and understanding, to really come to grips with getting a grasp on what's before you and the challenge of not knowing and feeling like you're chasing a diagnosis and everything that goes with it. So I want to be very empathetic and very supportive and very appreciative of the families and those people who are impacted by this disease. For our treatment professionals, they see this on quite a bit of a basis, and it often comes to them because there has not been an appropriate investigation before it landed on their particular steps. And I've talked to a couple of our treating psychiatrists who work at our children's hospital, and they said, we've seen this, and we've later understood that we were actually only treating symptoms and not understanding what was actually occurring. So they were very quick to articulate to me the importance of us having a better understanding as a community, as a state. I also have to tell you, as an Oklahoman, I was extremely proud when I started doing my research to find out what a great imprint that our state was having in this. I was really thrilled as a taxpayer of the state to understand that this is something our state is leading the nation in finding a way for us to be effective. So for that, I'm extremely appreciative. As a parent who's walked a similar path, thank you to those who are making a difference in this community. And for our state, I'm extremely appreciative and value the fact that we're able to invest and encourage companies like this and innovations like this. So without further delay, I'll read the proclamation and then present it appropriately. Whereas PANDAS and PANS are serious clinically diagnosed illnesses in children that display sudden dramatic changes in personality exhibited as obsessive compulsive disorder together with accompanying symptoms following a strep, bacterial, or viral infection, And whereas the OCD behavior of panda PANS can display itself as an intense fear or anxiety, and whereas accompanying symptoms may include tics, anxiety, depression, behavioral regression, deterioration in school performance, sensory sensitivities, severely restricted food intake, and more, and whereas researchers have begun to substantiate that this syndrome involves a misdirected autoimmune process that affects or weakens the blood-brain barrier, and whereas treatment needs for PANDAS and PANS vary by child, but may include antibiotics, steroids, IVIG, plasmapheresis, cognitive behavioral therapy, and anti-inflammatory medications, and whereas PANDAS and PANS is often misdiagnosed, undiagnosed, and undertreated due to a lack of awareness both for the public and even the medical community, now therefore I, Mary Fallon, Governor, do proclaim October 9th, 2015 as PANDAS and PANS Awareness Day in the state of Oklahoma. So congratulations.